I'd like to talk a little bit about why evidence-based programs for seniors are so important. First, let's start with the definition. What makes a program evidence-based? It's a program that's been tested. It's one that's been implemented throughout many different settings and populations, and that has reached many different people. And so why we think about evidence-based programs as being important is that they've been proven. We can think about advantages and disadvantages of evidence-based programs. The advantages far outweigh the disadvantages. So people who are not familiar with evidence-based programming may say things like, it's too hard, or it's unfamiliar, it's going to cost too much. Really, one needs to look at the advantages. The advantage of evidence-based programs, by definition, is that they're proven to work, that they've been tested in large populations. They're replicable. What it means for an evidence-based program in the Aging Services Network is that not only has the program been tested and published in a peer-reviewed journal, but it's also been packaged so that the same program structure gets delivered time and again. So you think about a program, what is its structure? How often is it offered? Who's offering it? What are the delivery elements? These are all things that you have to understand when you're talking about evidence-based programs. Why are evidence-based programs so timely now? I think it's because of all of the chronic diseases in America. If you look at the statistics, you'll see that about 50% of adults have at least one chronic disease. And chronic diseases increase as you get older. In fact, older adults, the majority, over 2/3, have at least 2 chronic conditions. So we have a burden of chronic diseases in America, but the issue is it doesn't have to be that way. There are many proven programs that can make a difference. And that's what we want to get across, is that there may be a burden of chronic conditions, but there are things, evidence-based programs and strategies that can help you prevent chronic conditions or help you better manage them. In fact, I was involved with a study, a national study of chronic disease self-management, the program out of Stanford, and this program has reached hundreds of thousands of people in America. We studied a smaller number, about 1,000, and what we found out is if people engaged in this evidence-based program, we could save an enormous amount. And when we costed it out, it's something like you could save over $3 billion, that's billion dollars, if only 5% of people engage in a chronic disease evidence-based program. So it's important and timely because of the chronic conditions and disabilities our growing aging population is experiencing, and it's something that is available. So I think, I talked about some of the disadvantages. People need to understand why evidence-based programs are important. They also need to be able to identify where to locate these programs. And I know you'll have other colleagues talking about identification, but it's not a mystery. These programs are widely disseminated through the area agencies on aging. There are lists of these programs with the National Council on Aging. And if you come to this website, this is a perfect place to look and see what the programs are, what the advantages of these programs are, and where you might find them, and what are the issues that you need for actual implementation. So I'm definitely a fan of evidence-based programs. I've been working for the last 10 years delivering evidence-based programs in our county, looking statewide and also nationally. And what I've seen is evidence-based programs do make a difference. They can impact what we call the triple aims of health reform. That is, evidence-based programs can result in better health, they can result in better health care, and they can result in better value. When we look at some of the outcomes that have been seen from evidence-based programs, and I'm just taking chronic disease self-management as an example, what we see are things like we have better self-assessed health. We have improvements in important lifestyle factors, which are risk factors. So these evidence-based programs are related to having you be more physically active, having you understand healthy foods and engage in a healthier diet. They are related to better functioning, so you're able to walk better, you're able to engage in all the activities that are so important for older people to be able to remain in their home. What else can I say about evidence-based programs? People want to know if they're easy to use, and the answer is absolutely yes. Evidence-based programs, I think, are actually easier to use than programs that are not evidence-based. And that's because part of the criteria of being evidence-based is often having a package program that can talk to you about step-by-step things that need to be done. And many of the programs are delivered in a group setting so that there'll be a facilitator. The evidence-based programming can help the facilitator know exactly not only what the content of the program should be, but what interactive exercises may be, so that the program will be delivered over and over the same way, and again, to maintain its evidence base. How do we know that evidence-based programs are not just a fad? Certainly, they've been very important in the Aging Services Network for the last 10 years. But it's not just evidence-based health promotion programs. It's really a confluence of looking at the evidence base. So whether you're talking about evidence-based medicine, evidence-based public health, evidence-based health promotion, or evidence-based health promotion for seniors, we're realizing how important it is to deliver evidence-based programs so that they will be standardized over time, that they'll be readily available for those who need it. People really want to know if one evidence-based program is better than another. And I think that's not the right question. What I'd like to reframe it is, what are you trying to accomplish? What are your goals? Evidence-based programs are designed to meet different goals and to also address different audiences. And I'll use falls for an example. Some of the evidence-based programs are to prevent people from having falls risk, so they bring in healthier adults. Other programs are for those who have a fear of falling or who've already fallen and may be a bit frail. These programs are geared toward helping you understand the preventability of falls, but also helping you engage in physical activities that can lead to to build your strength and also increase your balance and make you less likely to fall. So there's no one best evidence-based program. It's really the purpose that you're looking for, the audience. It's also how much money in a community you may have. Some of the evidence-based programs are relatively low cost. Others will have certification and license fee or need for equipment. So when choosing an evidence-based program, think about what health that you want to gain, what health behaviors you want to encourage, what population you're interested in, and how much resources that you have. These are all important factors in choosing the best evidence-based program for you and your community.